Good. Very, very good. Uh, don't, couple of focus points. This is the unit we're working on. Just really the most of the take-home stuff. There's about 3 areas that within this whole PowerPoint that are significant, particularly at the end where we look at the energy consumption that are there. So that's really the big part about this. To be fair, and I was presenting it to the group before you. There's a lot of the stuff that it's really not. It's important to understand. I think for people who are in health science, particularly if they're going into physical therapy, because that's really where understanding how muscle works and how the electrical stimulation of the muscle is important. It's really where the focal point of that is. So I know it doesn't apply to everybody, but I've got to give it some attention in the degree of presentation. And people who are in sport here, and we always have a lot of students in sport, either recreationally or actively here on the campus. That's another important area where it comes from. It's really what happens from. It's more application than it is theoretical principle. That might be the way to describe it. Nevertheless, we're going to look at really how the muscle works and where the energy comes from. And the first take-home point is how we use it. Okay, before the muscle moves, even as those little actins and myosin start to contact each other and we start to get contractions, we're building up initially something called tension. Tension is a force. And what's interesting about that particular force is that we're using, before we actually can see the muscle shorten, it's based on what it's trying to lift, what it's trying to move. So movement is a function of something called load. So effectively, if I have a minimal amount of load to lift or to move, very easy. That I'll only need a little bit of that tension to start, and the next thing you know, I can overcome the load. This is kind of like physics, and move it. If it's a bit heavier still, it might take a little bit more. If it's really heavy, it might take a lot more. That's kind of the idea. So the way we start using our muscles, okay, we do what's called isometric. We don't shorten it. We have to start, and they all start this way. Even if you're moving nothing, effectively it has to start by developing tension. For the longest time, and maybe it's still used today, in exercise physiology is just light years of what it was when we learned about it, 50 years ago. It's the whole idea. We used to do a mixture of isometric exercises. Literally, you could do them. You could do it in a dorm. You could just push on a wall and do exercises. There's a whole series of these things that you could do. That were there. They're called isometrics. And then it sort of burgeoned into different things. And exercise went from being organized, doing stretching and not doing stretching, and static stretching and ballistic stretching. There's all sorts of changes that have come over time in the idea of exercise physiology. I am not an authority on that. I know a little bit about it. Okay. But we start isometrically, which means same length. It doesn't shorten. And once it starts to move, it becomes what we call isotonic. The tension remains the same, sort of the amount that's firing remains the same. But once we start to move it, okay, then the length will change. So it's no longer isometric, but the tension remains the same. That's the distinction between these two words. Same length versus same tension. It's not every sport does that hold true for, but for most of our activities of using our muscles, it's true. First, we start isometrically, and then we convert to isotonically. And then they're talking about saying, and they give you a sort of an anatomical description of what's called a motor unit. So the motor nerve, and basically all of the axons, all of the tiny components of the nerve that are going to effectively make these muscle fibers fire. So they branch into terminals, and they form with each with a single muscle fiber. So a motor unit depends on the muscle. So the motor neuron, and we may have covered this a little bit before, but I did want to reinforce it because some classes we got to it and some didn't, consists of the motor neuron and all of the fibers So if you're doing very fine movements, those are muscles that really have a very tiny amount of muscle fibers. We control them very, very precisely. And that's it. So, and they're spread throughout. Muscle fibers are all throughout the muscle. So a stimulation of a single motor unit only will generate a weak contraction. It's not like we're just going to keep stimulating one spot. It just doesn't work that way. And this gives you a pretty good visualization of what they're talking about. These are different axons of many hundreds, if not thousands, that can be in a particular nerve, depending on the side of the a particular nerve, depending on the size of the muscle that it's going to, like a large muscle like this. And it goes to these different, and this is that illustration that kind of gives you the idea of how they came up with that sort of illustration that supported the idea of the neuromuscular junction. Your muscles don't twitch routinely. This is what happens in the laboratory, or this is what happens in the physical therapy unit. This is what happens when maybe you're at some facility where they're trying to do diagnoses. Okay, all of these are twitches or something we typically induce by design. When a muscle twitches ordinarily, it usually means it's damaged. So if we see somebody and all of a sudden you can see a twitch like that, what happened there? Why'd you do that? I didn't do anything. It twitched because there's a damage either in the nerve or the muscle itself. It's not a normal phenomenon. We utilize the concept of the twitch as something that we induce in the laboratory because we're either trying to diagnose or determine or treat a problem associated with the muscle or the nerve that's going into it. For instance, this idea of what's called an electromyogram, or EMG, is the acronym that's used all the time. And it's very, and for the students here who are in health sciences or want to go into physical therapy, this is really very important stuff. It doesn't necessarily apply to everybody, but anybody who's been an athlete or injured something and they underwent something called electrical stim, which has been used forever and is used today. This is the basis of why we use it. I mean, I had to use it on my patients. I know a lot of my colleagues who had them in their offices. I sent mine to independently to physical therapy and say, hey, it's a good idea if we use this, and electrical stim wouldn't be bad. I'll go into explain why that all works. So the myogram, if somebody has a carpal tunnel, is it a carpal tunnel? Is it something else? Do we have to operate? We use a test called an electromyogram. Do they have, is there sciatic nerve damage or a slip disc? This test to be able to identify that and the impact it's having, whether or not the criteria is there for an operation, is typically an electromyogram. That's one of the criteria. So it's been around for a long time, and there are people who are trained, physical therapists who are trained in this, what's called electrophysiology. Understand what happens. And basically the take-home point about this, when we talk about nerves and we talk about muscles, and you might remember me saying this, it's about frequency. The amplitude of the response is based on frequency. Whereas once you hit enough frequency to make a muscle contract, that thing we call threshold, it doesn't matter if you go over it by 10 times. That muscle's not going to be 10 times more powerful. It's not going to contract 10 times more strongly. If we wanted to do that, we got to stimulate it repetitively over a short period of time. That's what this looks at. So we're going to look at what happens by just inducing a twitch just to see how muscle works. And so it starts because you have a neuromuscular junction, because chemicals such as acetylcholine are released, and particularly this junction, but you have other things. This is how nerves work, how they talk to each other. They release chemicals. Okay, we don't see anything. It takes a certain amount of time for that chemical to get across that neuromuscular junction and do what it has to do. And then when we finally see a contraction, the contraction occurs rapidly and typically relaxes less rapidly. So it goes from contraction to relaxation, and it always is faster than it relaxes. Voila. That's what this. Here's the stimulus, whatever this was, milliseconds. So maybe this was 2, 3, 5 milliseconds. 5 thousandths or 2 thousandths of a second. Still, that's a finite amount of time. And it contracts rapidly, and then it relaxes a bit more. By the time it gets back to its resting point, it might have taken, oh my goodness, a tenth of a second. I mean, it looks dramatic on the graph. Muscles work fast. Nerves work even faster. So we're talking about already a fast area, and we're just trying to look what is fast, one being faster than the other, and why is the difference. The difference in the strength and duration of twitches are due to a lot of things. Okay, metabolic properties, enzymes. So muscles that we inherently use rapidly, eye muscles, finger muscles, contract rapid but briefly. Bigger muscles, and they use the perfect example, the calf muscles, more slowly and hold it longer. And this is where this is where we're taught about why muscles, how we can classify a muscle. The limitation that we have here is unless you actually have to see how vast and powerful a muscle is, particularly in the lower extremity, or the big muscles in the upper extremity, you have to hold them in your hand. You have to have a cadaver dissection. There's nothing we can't do that. There's no why they would do a cat. It's just I had to feed the cat this morning. It's hard. I couldn't dissect the cat with 2 cats at home. I'm in enough trouble. He hissed at me yesterday a lot. I went out. It's raining and you didn't fix it. 5 seconds later, I went out. You still didn't fix it. That's the cat. And that's only one of the cats. Nevertheless, you can't possibly know why they call vastus lateralis and vastus medialis vast unless you lifted one up and go, son of a gun, that's big. The calf muscles are enormous, proportionally. Doesn't matter if you're petite or if you're big or whatever. It doesn't matter. Okay. So this is the whole idea. It's a perfect example. The lateral rectus is the muscle that moves your, I'm glancing this way. Somebody just came in, I'm looking over there. Moves your eyeball to the outside. Very, very rapid. So all those rapid eye movements, up, down, side to side, very, very quick. Okay. It fires fast. It unfires fast. So it fires and it resets rapidly. The gastrocnemius, and there are 2 of them, 2 heads, medial and lateral, are power muscles. When you're jumping up to grab something, that's what you use. Jumping up to get a rebound in sport, making any kind of an action like that in sport, those are your power muscles. They're not only are they large, they fire fast. And your postural muscle is the soleus. When you're standing for a long period of time, it's designed to be firing to hold you in a position. And then it has to relax a little bit and it'll fire once again. But it's designed to maintain it. That's why we know it's postural in nature. And this is a perfect example. If they said, what 3 muscles would I pick to demonstrate this, I would have picked those 3 muscles. And anybody who is skilled, who has a certain amount of knowledge about particularly how posture and power muscles work, would pick those. They're a perfect example. And typically the twitch is only in the lab or when somebody has a neuromuscular problem, if they have an injury or something like that. And you'll see people like this. You'll see almost involuntary. You'll see, when they have damage, you look at their muscle damage, and maybe you'll see one facially, and you'll wonder why it's good because they don't even know what's going on. You certainly can't control it. I don't teach muscle responses depending on the field you're going into. This is something they may give you an idea particularly if you're going into health science and physical therapy, though. They're graded like 0 to 6. Typically, muscles are strong. You can move them against resistance. So normally there's different criteria for each grading, whatever table they're using. The interesting thing, this is probably part for those going into the nursing area, the assessment course, which the students from last year are doing that now, the physical assessment course. That's where you would be looking at things like that. Now, how specific they are with testing, I don't know, but certainly being able to, it'll be part of the neurological exam. Okay, measuring muscle strength is an important part of a lot of things when you're trying to assess where the damage is that are there. The big deal is really, to me, frequency. Strength is not a big deal. In the nervous system, it's everything. If it's very, very loud, the nerve is being fired frequently. If it's very soft, less frequently. If it hurts a lot, more frequently. If it's kind of like, that felt uncomfortable, less frequently. So frequency equals amplitude. It's a little different in muscles. It's similar, but not the same, because we reach certain points. And that's why they're useful, particularly, and why we use them in rehabilitation or for testing. Okay, so a single muscle, we call it a twitch. And what a twitch is, we stimulate it and we wait a sufficient amount of time for it to relax. We can measure this. I mean, I have a device that I use with the advanced physiology. If I'm doing it, hey, you can come by and you can watch how we do it in our phys lab on Monday afternoons in the spring. Basically, we have a machine that we hook up, put pads on there. Maybe you've had this if you were undergoing rehab in sport. And basically, I can hit a button and it'll cause a muscle to fire. Basically, it's kind of like inducing a twitch, even though I'm doing it for a whole muscle. And then I have a graphic display of how long the latency period was, how long it took to contract, how long it took to relax, that type of thing. So an idea, and they're talking about temporal summation over time, what effect this is having, and how we apply it to people with injuries and how they get better. So if we stimulate it, you go back here, we've waited until completely relaxed. What happens if it isn't completely relaxed? If we stimulate it again, there's still more calcium in those wells. We're going to shoot some more out. And this is what happens. So now we've gone from 10 of those. If you go back to that last one, I know I'm flipping flopping. There's one every 100 milliseconds. That's 10 a second. Let's double it. Now we're doing 20 a second. We call this summation. Another name we give to this is called staircasing. Because if you drew up like a flat top on this, it would look like a staircase, so to speak. You could basically create that analogy. So that staircasing would occur. We're only allowing it to relax partially. Then we're shooting more calcium out and more. And finally, we're going to get to a maximum. And all we have done is stimulate that nerve in the laboratory, doubling the amount of frequency that we're doing it. We're summating it. We're adding to it over time. Oh, let's triple it. And if we triple it without going crazy, the idea of when we start to see the term tetany or tetanus, tetany or tetanus is a muscle spasm. The disease tetanus was named for that phenomenon. So you'll learn about this in micro early on. You have me called Clostridium tetani. It's the name of the bacteria. Don't worry about it. It's everywhere. Can't get rid of it. That's why every time you have a wound, what's the first thing you ask? Tetanus shot. It's everywhere. It's on the bottom of your shoes and the carpet. It's all there. I'm like, oh my God. So that's why we always have a precaution with regard to that. So what happens if we increase it to triple it, it's called unfused or incomplete. And it's almost like the muscle spasms, but it's quivering. And what have we done? Now we got 3 every 100 milliseconds or 30 a second. Not done yet. Now what happens? If we change it and we really fire it a lot, we're going to fuse it and get a complete tetanus, a true complete muscle spasm. And the goal of that is we're going to fire it so much we're going to yield fatigue. Now we're stimulating. You did it 5 times every 10th of a second, or 50. You go from 50 to just about 100 times. Very, very rapidly, you're going to create that fusion. Why is this important? We do this from a rehabilitative step. If someone has a muscle spasm or muscles that continuously spasm trying to break it, what we would do, typically with backs, this was classic. Their muscles were we use muscle relaxers, we use painkillers, we use massage, we use other physical therapy modalities, heat, ultrasound, all that stuff. The thing that worked consistently the best is you put those same pads, it's non-invasive, on them, and you basically crank it up and hold them in tetanus for maybe 20 seconds, and then relax it and repeat over time, a couple of times a day, 3 times a day. You take them to back and forth to physical therapy, trying to force that muscle to relax. So it's a combination of therapies. It's not just muscle relaxers or medicine. It's not just painkillers. It's not just anti-inflammatories. It's a whole multifactorial approach. It's used a lot. If an athlete has injured a muscle and we want to strengthen it, we start strengthening it. The fancy term is called surge. We gradually increase the frequency of those stimuli, and more portions of the muscle. We're intentionally exercising the muscle without them having to exercise. So we can do it scientifically without damaging it more. That's why this is important for folks, and why it should be covered. I'm not expecting you to know a whole lot about it. What you probably should know about this is the idea there's always a latent period, and it contracts, and then it relaxes faster than it contracts. You should know that different muscles respond differently. Postural muscles and power muscles have you can see a longer span than something we use constantly, like eye muscles, like finger muscles. Totally different. I'm not worried about muscle responses. What happens, the whole idea of a twitch is something that ordinarily we only see when we're inducing in the laboratory, barring an injury in the nervous system or the muscular system, and that they summate over time. And when we increase this frequency a little, they'll start to summate. Why? Because we're pumping out calcium before all the calcium is brought back in and the muscle completely relaxes. So before it gets pumped back in, that sarcoplasmic reticulum to completely relax, we push more out. Because there's always more in there up to a certain point. And that we will even try to induce complete tetanus in an injury, in a rehabilitative sense, to effectively manipulate the muscle to fatigue to break spasm. That's really what this whole unit is about. Now, why don't we just make a stronger signal? Okay. And the graph shows it better. If we reach threshold, if we don't reach threshold, nothing's going to happen. That's an end plate potential. Nothing. There's no fiber that's going to respond. Once we reach threshold, we'll have a fiber or two respond. As we gradually increase it, the amount of voltage, the power. Once we reach maximum, where all of those motor units have been activated, the fact that we increase it more over that maximal stimulus level has zero effect. Once it's contracted maximally, it's contracted. So it's much more effective to do with increasing frequency at maximal stimulation than just trying to, I'll just crank it up more and more. It reaches a point of no additional change. So temporal activity, frequency is much more beneficial rehabilitatively, and much better way, I think, to understand how we can maximally stimulate a muscle than necessarily just the amplitude of the frequency itself. So that's what they're calling it there. The stimulation strength, okay? Once we get to maximal stimulus, that's it. All the motor units have been recruited. It's not getting any more. It's the whole thing here. So small fibers first, then larger, then largest. And again, this whole idea of asynchronously, not all at the same time or the same place. Because it's all about fatigue. Your body's constructed that way. So that we're not always that the different size fibers are in different locations. And they just show you the graph. I don't get a lot out of it. And lastly, muscle tone. I mentioned it in passing before. Your muscles always have some degree of contraction. We may, not to say we don't rest some periodically, but by and large, we're constantly having reflexes that are maintaining a certain degree of what we call muscle tone. That's there. And that's the whole idea. To me, it's sort of the major thing I think the whole idea of the human body and the human mind is very much use it or lose it. It's just the way it works. Intellectually, I think it's very true how when we hear about people succumbing to Alzheimer's, I mean, eventually it's going to happen if someone's prone to it. Happened to my mom. My mom is doing crossword puzzles when she's 88 and fast. You get the idea. She used her mind a lot. Her body deteriorated much faster. I think that's very true. I'm sitting here doing this at 74 years old. I go crazy if I forget anything. Then I think it's going. That's me. And so your body's the same way. Listen, Lou, to what you're telling everybody. Get your posterior to the gym. We're going to talk about the gym in a second. I heard you. Very quick, isotonic contractions. The only thing you have to know, when we lift something and shorten a muscle, it's called concentric. So lifting it up, shortening the muscle, concentric, putting it down, eccentric or eccentric. All that means is we're firing a muscle. It doesn't mandate that the activity involves shortening, because we can be firing it when we're lengthening. I mean, it wouldn't be very smart to pick it up and then just drop it. Now, if you didn't want to keep it for a while, suckers are expensive. So that's all the difference between, and that applies to these isotonic contractions. And I'm not worried about the isometric contractions, spinning your wheels, fine and dandy. Don't care. This is it. Last part, most important. Energy. Okay. Oh, we learned about that. ATP. I'll buy that. We have a certain amount of stored ATP available to move that muscle. What's it going to do? As long as we have it, we can detach cross bridges. We can pump that calcium back. We have those wonderful sodium, potassium pumps quickly resetting things. It lasts for 4 to 6 seconds. Don't be surprised or anxious about that. Very little of what we do, 4 to 6 seconds. We don't maintain doing our muscles for a very long period of time unless we're doing some very specific activity that requires a lot of energy expenditure. You run out of resources quickly, even in sport. If you think of a tennis player, very few points last more than a few seconds. I mean, you have a long rally and it's going to last on clay. Okay, it'll last for a long period of time. They're conditioned for that. But by and large, that's a short burst, and then there's a rest in between, and you're able to reset everything. Different sports have different demands on them, and that's the context I think of these things in. But 4 to 6 seconds, okay, very, very few activities we have to do that. ATP is the only source of energy. It must be regenerated quickly. So how do we get it so you can run, you can use a minute and run a long race? Where does this all come from? The next thing is this. It's called creatine phosphate. This is sort of the oddball thing, is all these people eating mud. There's nothing wrong with it. If you're young and healthy and your kidneys are fine, and you are in an exercise program and someone intelligent is giving you guidance and knows what they're doing, and you're eating protein powders, fine and dandy. Enjoy. Your kidneys will get rid of the nitrogen that's inevitably part of it. The notion that eating more things with creatine or creatinine powders is going to magically make you, in and of itself, that's not enough. You have to be able to exercise, know what you're doing, have proper guidance, and your body has to be able to tolerate. That's what trainers are for. Protein powders like creatinine are nothing more than ingredients. Your body doesn't magically make them into muscle. That's this is muscle powder. It's muscle milk. It's going to immediately go to your muscle. No. Your body immediately takes those proteins and breaks them down into amino acids. You have more building blocks. If you're training properly, yes, it will do that. If you're not, it will not. I can sit on my rear end and watch TV and eat protein powders till the cows come home. I am not building muscle. Just not going to happen. So get that out of it. Get that. Nothing wrong with it if your body can tolerate it, and you are medically sure that that is the case. The big problem is kidneys, by the way. This is called direct phosphorylation of ADP. So we're using that ATP. We have ADP. Remember, ATP. The whole way it works is we chop off and release energy by one of those high energy phosphates. We did that in the very first couple of weeks of this class. Boom, off went that high energy phosphate. How do I put it back so I have more ATP? We have another molecule called creatine phosphate, yes, a derivative of that creatinine powder, and that has a high energy phosphate. Okay, and you're going to see that's the next step. After that, we have to go what's called anaerobic. Why is that? Because no oxygen is getting in. Why is that? Because when your muscle is contracting, your blood vessels can't deliver blood to the muscle, and that's where the new oxygen comes from. If you haven't got the oxygen, you have to use something called glycolysis. We're going to get to all of that. This is all part of what's called metabolic scheme. I don't go into teaching it at this level. I think it's crazy to try to do this at this level. Some people will try to talk to you about it in micro. This involves the Krebs cycle. I don't know that you have any use for it. Sum and substance of it is without oxygen. Remember I told you, we get our energy from foods we consume. All those wonderful shared covalent bonds, particularly the nonpolar ones. We gobble and suck the energy out of them. What's left is a bunch of electrons that we have to find a parking place for. The parking place is oxygen. What happens if we don't have any oxygen? We're in trouble. Then we have to find someplace else to park those electrons. We park them in this stuff that you've heard about called lactic acid. And lactic acid, when it builds up, is very, very damaging. And the big problem with overuse of muscles and why we have muscle spasms, it has to do with waste products, one of which is lactic acid. Stay tuned for more. So, next step, this phosphorylation. Okay, creatine phosphate, we only find it in our muscle fibers and our skeletal muscle fibers. It's another one of those high energy phosphates. Okay, I need more ATP. We'll steal it from the creatine phosphate, okay, because there's an enzyme there that lets this happen. And oh boy, we'll have enough ATP by stealing it to last for a total of about 15 seconds. We can add another 10 seconds. I'm excited. Well, if you go from 100 to it, if you ran a 100-meter race, now you're going to do a 200, you probably have not enough energy to go around. Understand we have resources, but they're limited. Most of us, this is not something that happens. The analogy for those of you, whether you've watched kids, you're a parent, your greatest fear when the kids are little is they're going to take off. All of a sudden, if my dad said to me when I learned how to drive, if you see a ball in the street, stop, because there's going to be a little kid chasing you. He was absolutely right. When your kid takes off, or your dog, my dog would take off, and your dog takes off, you start to run after them. I mean, there's physiological limits. You just can't. But you have enough. Do you have 10 or 15 seconds shape? Probably that's going to work. Because they take off in the street chasing something, oh my God, they're going to get hit by a car. It's every parent's nightmare. That's what this is all about. Be able to understand that. So you have now between the ATP and the creatine phosphate, I got 50. Most of the time, that's good enough. I could chase out, grab them, scream and yell, and hug them to death because I'm so thankful they didn't get hurt. The trouble is when they grow up, you're a little less thankful. That's right. I adore my kids. I got FaceTime with my son showing me his cat because he was working from home, and the cat must have gotten into a fight someplace. He wants a consult on FaceTime to see if he should take the cat to the emergency hospital. Which didn't look that bad. Those places are ridiculous. If you've ever had to take a pet there, you got $500 to walk in the door, maybe $1,000 these days. Think twice. That's only enough to get your pet taken care of. It's expensive. Like we had one that was pretty bad. We took him. One of our, are you ready? He swallowed a sock. Note well for you golden retriever owners, they will the dumbest dog ever. Swallow. They swallow stuff. Moving on. So 15 seconds. Good luck. So here's how it happens. Here's the ADP that we have to sort of re-energize. We'll steal it from here, and we got more. 15 seconds. Now what happens? I've run out of little tricks. At this point, I have to use stored sugars. The sugar that typically is used is glycogen, and so we have to break it apart. Okay? Your only place where you can really store carbohydrates is muscle. So we have some that's stuck in there, but we don't have any oxygen. So the process is called glycolysis. It literally means splitting the sugar. Without oxygen, we get at most 2 ATPs. With oxygen, being able to use those mitochondria, we get, this book says like 30 or 32. You get somewhere around that, 30 plus ATPs. Typically 32 to 34 ATPs, I think would be more accurate. You get about 20 times more than you get from glycolysis. So why don't we use the oxygen? The muscle's contracting, the blood vessels can't get in there. You lose the blood supply in those early moments. So low oxygen levels prevent that. And this chemical, which is a fancy name called pyruvic acid, is what actually goes into the mitochondria as long as oxygen is present. So the pyruvic acid usually goes in there, okay, to start aerobic, but aerobic means you have to have air. Read that as oxygen. Bulging muscles compress it, impairing the delivery. In the absence of oxygen, we call it anaerobic, without air, without oxygen, glycolysis. The problem is we still have those electrons and we need a parking place. We park them, you don't have to know this, it eventually creates lactic acid. We park them on pyruvic acid and they make lactic acid. And lactic acid, we have a very limited capacity to absorb and utilize. It's going to cause damage eventually, even though we can even temporarily use it as an energy source. So with all of this explanation for you, okay, the lactic acid gets into the bloodstream. Lactic acid can be used even by the heart, your kidneys, or your liver. But sooner or later, it's going to build up so much that you're going to enter something called acidosis. These waste products are going to accumulate and take your toll. So it yields only 5% as much ATP, even though it does it faster, because it doesn't go through this complicated thing called the Krebs cycle. That's why it's faster. And eventually, well, what are we going to do with it? Once we have oxygen, the liver will change it back to this pyruvic acid so it can be used as a realistic energy source. You don't have to go into any of those details. Suffice it to say that we're building up bad waste products. That's how do we interpret that when we're using it? We end up with, oh my God, my muscles are short. Why can't I keep chasing after that dog? I can hardly move. And we have to stop and do what? Catch our breath. And effectively what's happening then, our muscles are fatiguing, they're pain, they're spasming on us. And this is because of an accumulation of waste products, one of which is in our bloodstream called lactic acid. You will see further. And all of that, all that we have stored in there will give us, yes, not 5 minutes, not 10 minutes, another 30 or 40 seconds. We barely have a minute of intense ability. With modern day exercise physiology and techniques like that, that's why it used to be, they used to consider racing a mile a distance race. Now it's more of a sprint because we've increased people's capacity to be able to effectively do this for longer periods of time. They can sprint for them. That's amazing. The first guy to do it under 4 minutes, you might know, was back in the 50s, who was a doctor named Roger, or a medical student named Roger Bannister in England. He broke the 4 minute mile. And I mean, that was his area of expertise as well. To understand that, so obviously the training and conditioning he did facilitated, enabled this process. Again, I'm not an exercise physiologist. I'm just giving you the basics. And that's the problem. So what do we do? And not only somebody who's a trained athlete, anybody, I can do it. I do it all the time. I should be doing it more. you go into what's called aerobic respiration. It's the foundation of cardio in the gym. You basically are going to you're going to scientifically increase your heart rate, marry that to the amount of breathing, oxygen coming in, more importantly, carbon dioxide blowing off. That's how you compensate for any lactic acid. You get rid of the acidity by getting rid of the carbon dioxide. It's something you get in respiratory physiology, which you'll get in AP2. And how do you get that adjusted? You're able to tailor how rapidly you're running, or in my case, how rapidly you're walking, and what elevation, if any elevation at all. So I know I'll get someplace where I can do that. And even I can, maybe not the first time I do it, but sooner or later, I'll do 2 or 3 miles on a treadmill in a reasonable amount of time, and a reasonable amount of energy, at a reasonable amount of elevation, even for somebody who's not a kid anymore. And you can your tolerance gradually increasing. That's what cardio is about. Okay, so consider 95% of the ATP during rest and light to moderate exercise. Okay, series of reactions breaks it down, more ATP, blah 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 blah. Fuels used include glucose from glycogen, bloodborne glucose, and free fatty acids. That's the good news. Doing the cardio part 3, 5, 6 times a week, elevating your heart rate to a specific level, that's what keeps your heart in shape. Use it or lose it. Okay. You get a little side benefit by pushing all that blood around through your bone marrow. Guess what? Your immune system stays in tune. You see, it's been studied forever. You statistically are much less likely to have disease. Your immune system is stronger. And now the big benefit for a lot of people is weight control, because after that first 30 minutes, you start to burn this free fatty acids. They actually have more energy. So you break down stored fat. That's called a fat burn. That's the good news. So all of that's where this dovetails in. And for people in health sciences, if they're going into this, exercise physical therapy, all that's important. And for everybody else, it's important lifestyle-wise, I think. I should do more of it. And yeah, you can do that for hours. Even I can do it for hours. So the length of time the muscle contracts, light to moderate, hours. Okay, the point at which, that threshold point, we all start that way when we start an exercise. So on that treadmill, I'll start going, and all of a sudden I'll go, okay, as I start to increase the elevation, increase the speed, it'll get to, okay, now I know where I am, and I'm looking at my heart rate at the same time and going, okay, I'm at my target level. How do I maintain that? So whether that's adjusting the speed or adjusting the inclination, whatever. Or if you're jogging, if it's a rotten day out, like it was yesterday, raining all day, and you want to get your workout in, you're on the treadmill inside. That's what they made, those wireless headphones. I got the ones that don't pop out of my ear. So the point at which muscle metabolism converts. And they just show it to you. You're only getting barely a minute here for a long period of time. The fatigue, okay, is something that's going to happen, okay, unless you convert over to aerobic. And so mostly what causes spasms are these waste products in the form of typically ionic charged particles, affecting all of those electrical stuff we talked about at length, different things with inorganic phosphate from ATP breakdown. So there's scientifically, we understand what's damaging the muscle, why it's going into spasm. It's very hard. It's a very, very difficult area, because a lot of people have things like, you'll hear about things like restless leg syndrome as they get older, trying to deal with spasms or spasms at night, even in young people. It's a very difficult management problem. And I treated a lot of patients with this. There's no magic medicine or formula to take care of it. That's there. But what does happen inevitably when you're running after that kid or running after the dog or whatever, okay, and this is just more of that stuff, lack of ATP is rarely a reason, except it's severely stressed. Sooner or later, there's this. You got to catch your breath. They have a fancy name there. They call it EPOC, excess post-exercise oxygen consumption, catching your breath. So you get to a certain point where your muscles sing out to you. Your body says, I just can't do it anymore. And what do we all do? We sit there for a while, depending. Even you just do. You can't have it. You got to replenish that oxygen. That lactic acid has got to be reconverted. That only happens in the presence of oxygen, because now we have a parking place for those electrons, and we can take them off the lactic acid, which is bad, put them back here, which is good. Not because you have to know all that chemistry. Replacing all the stores we used, replace all this other stuff, and go back to the starting point. So we're replenishing extra oxygen to basically go back. I didn't know that was formally referred to as an oxygen debt. Maybe it was. I never did. That's what I have to share with you today. On Monday, we are going to finish this muscles unit. The likelihood is either 2 weeks from now, or maybe 2 weeks in the start of either the Monday of the last week of school before Thanksgiving, or 2 weeks from now, there will be a third exam. More information on that Monday. Thank you.